Hi, it's Dr. Janet Pope, or at Janet Burdope, tweeting for At Room Now. This is ACR 2025 in beautiful Chicago. So I wanted to talk about, does your neighbor matter? And of course, I'm not talking about where we live. I'm talking about something from a basic perspective. So Dr. Sarah McCoy did a beautiful study that she presented in abstract number 1684. So as many of you know, she's a translational and clinical scientist in Sjogren syndrome and a rheumatologist. So here was the question. If you have Sjogren's and you are Rho positive versus Rho negative, what does that look like in the milieu of the cells around the gland where you've had basically a biopsy of a salivary gland? So she had some biopsies of patients with lymphocytic infiltrate who had Sjogren's disease, who were Rho positive, and some who were Rho negative. And she found that looking at the cells in the milieu and the potential signaling, that Rho positive patients were very different than Rho negative. And then she went on to look at, well, what if you're Rho 52 positive versus Rho 60? And even in Rho 52 and Rho 60, some of the cell signaling was different. Now, what is the take-home implication? So right now, this is interesting. She had beautifully illustrated pictures of how these cells are different and what the cell types around the Rho positive versus Rho negative are. But what might be really, truly important is what would be the response to therapy in a Rho positive patient versus Rho negative, or a Rho in the 52 versus a Rho 60. So more will come, but I thought this was one of the ACR bests that I've seen today because of the elegant science and a potential eventual clinical take-home message. Thank you. Please follow me at Room Now.